TB is the second leading infectious disease after COVID-19 with a reported 1.6 million deaths in 2021. This includes the 187,000 people with HIV. TB prevalence is significantly higher among men than women, particularly in low and middle income countries. In 2021, an estimated 10.6 million people fell ill with TB worldwide. Out of these, 6 million are men, 3.4 million are women, 1.2 million are children. Following the gender disparity in terms of prevalence and cases, this fact demonstrates that TB has distinct impact on various demographic and gender. If the specific requirements of those affected are ignored, the entire population, especially women and children, is at risk of contracting this deadly disease. Working in partnership with key stakeholders, the Leaving No One Behind Transforming Gendered Pathway to Health for TB, we call it LIGHT program, is working to generate answers to this important problem. For example, one of the strategies we work along is to encourage more men to seek care for TB, and what contributions will these strategies have to the fight against TB. Another strategy is we're trying to find answers that will likely include rethinking how TB services are provided in health facilities and communities. For example, should TB services be provided outside of working hours? This is to try to capture men who are the breadwinners and they work during the working hours in various kinds of work, including casual works. Or should we bring health facility closer to where men are likely to be found during work, such as workplaces? In the LIGHT program, we believe that encouraging men to seek TB testing in their communities and health facilities before they become very sick and spread TB to women and children is key to ending the TB. Over a number of years, international donors have provided lump sum of shares of fundings to try to fight diseases like HIV, tuberculosis, and malaria. Apart from funding, a number of strategies, including TB, are missing the gendered approach, where they should emphasize on men as a targeted population for various interventions. Gender impacts all aspects of the disease, including transmission, testing, treatment, adherence, and outcome. On the other hand, the topic on how gender affects TB has been a neglected research field, and that gender has received little attention in the context of TB control. This may be why gender issues and TB has not been discussed at great length in any of the policies or initiatives that has been analyzed. In the context of Africa, the Ministry of Health and partners urge the team to design and implement targeted TB care and prevention measures among men. Globally, we were on track to achieving the Global End TB 2030 strategy. However, the COVID-19 pandemic severely affected this program. In 2020 and 2021, for example, fewer people sought care for TB symptoms. This reduction in care seeking means that people with TB were not diagnosed or treated. Consequently, these people with TB did not access health care, thus the spread of the disease will move to other bigger populations, including women and children. The LIGHT program aims to further highlight the importance of finding and treating people with TB who have not been tested, especially men. This approach will not only benefit men, but it will also prevent men from spreading TB to women and children. That's why I work toward health for all.